Hi, I'm Dr. Joe Prendergast to tell you a little bit today about why I'm so interested in L-arginine and what it has meant to me personally. I began when I was 37 years old, and because of some vague abdominal pain, I had the need for a CAT scan. No serious other problems, but I was filled with atherosclerosis. The person who was doing this exam, the radiologist, said, "You're 80 years old inside. I don't know how you haven't had any symptoms." And with that, living near Stanford Cardiovascular Unit in Palo Alto, California, I began a long trail with working them to find out what the right diagnosis was. So at age 37, when I found I had severe atherosclerosis and I had severe problems in my family with my father having his first major stroke at age 42, I knew I was in trouble, and then joined Stanford Cardiovascular Research to be able to find out just exactly what the dose should be for me and for anybody else in the world. This fruitful partnership I had with them came to good fruition when the Nobel Prize in Medicine was given in 1998, involving two people who had spent some time in that cardiovascular unit at Stanford. But I never thought I could reverse my own personal situation. It's concrete, it's calcium, it's embedded in the arteries. I could never get rid of that. But when I was going along further and finally needed another CAT scan in my stomach for some vague reason, I found I had no plaque at all inside me. This was a situation that I never thought could be something that could happen to me, that I could actually reverse it. The next day I went and got a heart scan, so we had all the plaque counted again, and what I found is that was true. I had 0 plaque count. I'd completely reversed my atherosclerosis. So as I go through life and realize what it really means to me, and since I incorporated this whole situation in my practice in 1991, I realized that we have stopped all research into what causes all these problems because it works so well with what we've done. 17 years, no admissions, no strokes, no heart attacks, and most of my people have diabetes. It is a splendid time for me, and it is for anybody else who is within the range of my voice who can understand the power of L-arginine. Now, I've talked a lot about L-arginine, but it's important to know that anybody who's really passionate about what they're doing will want to constantly improve the product. So I've teamed with Synergy to do ProArginine Plus. It is the best thing we've ever put together. That's ratified by the people at Stanford in cardiovascular research, ratified by the anti-aging people in the Buck Institute in Marin County, and certainly by all my patients. We have 80% of the people who have diabetes, and in 17 years we've had no problems with strokes, no problems with heart attacks. I've not even had any admissions in 17 years. So this is a striking example of how we can use this product for real power for health. And this is something that not only benefits me, it benefits you and anybody else who you are working with to improve their health. It really is your time.